My name is Mike. It's been a 55-year journey to get to where I am now. I used to spend much of my life pretending I didn't see what other people were seeing, that they didn't see the flaking and the plaques. I get it. When someone has moderate to severe plaque psoriasis, it's hard not to look. That's all changed though.
My name is Nancy. The past few years have been great, but before that things were tough. Because my moderate to severe plaque psoriasis, I used to miss so much. Birthdays, graduations, weddings. I didn't want to see anyone because, well, I didn't want them to see me.
This is what happens when two ILUMYA patients meet up and talk about their journeys.
I had no clue that it was psoriasis. I knew why my skin was flaking. Mm-hmm. I knew my skin was itching and red and raw, and it continued to get worse and worse and worse.
I just wanted to be by myself, turn the light off and be by myself.
Yes.
And,
I never want to go back to that again. I feel I won't have to.
You can't wipe the smile off our face, I don't think, right now.
I know, at least for me, when I first started, I had 2 starter doses and then start the 4 times a year.
I can go from South Carolina to New York State and come back to South Carolina 4 doses a year and 4 days a year to make the other 361 days pleasant.
That's right. We don't have to rearrange our lives and our schedules around that because we are only talking about 4 appointments a year.
Correct.
That's nothing.
I felt so good about myself after the first year. I went back to the dermatologist without a meeting, a scheduled appointment. And I took a dozen roses to the ladies and dropped it off to them.
Yeah, I feel the same way about my dermatologist. And this is so much easier than, first of all, taking a pill every day, having to go remember to refill it, and so on and so forth, and having to go for a steroid shot and all this. And the only thing to do is to pop in and
That's
2
it.
minutes and I'm gone and on my merry way. It's priceless.
Yeah.
Reactions to ILUMYA vary from patient to patient. The most common adverse reactions for ILUMYA compared to placebo are upper respiratory infections, injection site reactions, and diarrhea. Don't use if you are allergic to ILUMYA or any of its ingredients. Before starting treatment, your doctor should check for tuberculosis and infections. Tell your doctor if you have an infection or if you plan to or have recently received a vaccine.
It was so simple after all of the things that I endured over 55 years to think that it was like turning a light bulb on and it was all better.
Now is the time to discover a treatment that's in it for the long haul. Visit ILUMYAmeetup.com to tell us your story and meet more patients.